Hello, welcome to the show. Let's start off with this question. Do you or someone that you know find it difficult to swallow foods or liquids? Speech pathologist Kyle Meades from the Therapy Group of Tucson is here to tell us what this is called and ways to actually improve the condition. Kyle, thank you so much for coming back in.
Good morning. It's always nice to be here.
I always learn something when you come in. Starting with, let's start with the name of this condition.
Yeah, this condition is called dysphagia, and that's the difficulty swallowing foods or fluids. A lot of people have this problem.
Okay, and so we were kind of chit-chatting. There's so much
chit-chatting.
Yeah, there's so much to learn about this. So we're saying, you know, having a difficulty swallowing foods or liquids. What causes that, or is that something that we can kind of notice today? Like, you know, I'm kind of noticing this.
Normally people know when they have difficulty swallowing foods or fluids, like with, you know, eating is such it's a personable thing, and when people can't swallow their foods or fluids, or if it gets stuck, they'll know. It just becomes uncomfortable. Then they'll normally go to their physician's office, and the physician will say, hey, go see the speech therapist, because that's what we do. So there are different types of swallowing disorders. There's an oral phase to swallow. There's what we call a pharyngeal phase, which is below the chin. And then also there's an esophageal phase of swallowing, and so that's way, way down deep. So a lot of people have trouble either in the oral phase or the pharyngeal phase of swallow. And one of the biggest symptoms is coughing, or my food just gets stuck. So, and there's a picture right there on the screen. You know, you can see the larynx there and the vocal cords. That plays a big role in swallowing. So a lot of people, they'll go to their doctors, and the doctors will say, go to see the speech pathologist. And so that's what we do. We'll make an assessment, and if we think that the person needs to have an x-ray, because they do have x-rays for swallowing, there's an example there on the screen, they'll go to the hospital or an outpatient clinic, a radiology clinic with a physician and a speech pathologist over there. They'll get a report, bring that to us, and then we'll do the treatment.
And you know, that's what I was telling you when we first sat down right now. I said, when I was reading everything of what we were going to talk about today, I was thinking that I wouldn't think right off the top of my head, if I'm having a hard time swallowing my food or my liquids, oh, speech pathologist, that's where I should go. And you were kind of explaining how you and the doctors kind of work in conjunction with one another.
When I first started this profession back in the 90s, I used to work in the hospital setting, and we would actually do the video fluoroscopy studies of swallowing in the x-ray unit at the hospital in conjunction with the radiologist, so we have that knowledge. But you're right, we don't have all the radiology equipment at our office in our outpatient clinic across from TMC. But if you do need that assessment, and that's what it looks like on video there, if you need that assessment, you can go get that done at the hospital. They'll generate a report, they'll give you the report, then the patient brings that back to us. But not everybody needs that moving picture of swallow. You know, a lot of times when somebody comes in and says, hey, you know, I'm having trouble with my foods or my fluids, we can modify the texture or the consistency. So, and this is the funny thing, a lot of people think that water is the easiest thing to swallow. Yeah, it is, but it's actually the most difficult because it moves so quickly. That's what people get, quote, choked up on the most, is water.
And so if we do through, you know, whichever path leads us to the fact that this is the condition that you're dealing with, what kind of treatment do we end up? I know you were kind of mentioning, you know, different foods and liquids, but what kind of treatment do we use?
Well, there's exercises to strengthen the muscles. You know, a lot of times after strokes or traumatic brain injury, people have muscle weakness. I've talked about it on other segments. It's called dysarthria. You know, muscle weakness can cause swallowing problems. A delay in the actual trigger of the swallow reflex can cause swallowing problems. You know, that's all neurologically based, but there's exercises like muscle strengthening exercises. You can also modify textures, like you can modify the consistency of the fluids. You can also change the texture of the foods. Sometimes people have trouble with chewing and swallowing crunchy things, so you have to moisten it up. Or some people have trouble with solid food, so you have to kind of chop it up. And you know, at the worst case scenario, and you see this a lot with long-term care, aged care, nursing homes, you know, somebody might have to have a puree diet. Or if someone can't really swallow at all, and let's say it runs the risk of going into your lungs, you can develop aspiration pneumonia, and that can kill you. You can die from infection. So sometimes you have to have a tube that goes into your stomach. Also, short-term placements, they have little tubes that go through the nose and down to the esophagus so you can eat appropriately. So
I think one thing that I'm really taking away each time you come back on this show is that I think that people are learning more and more the types of conditions and types of things that your office can actually and your staff can help them with. And I think some people may think speech therapy, they just think speech impediments or something that's
child speech disorders, language problems, stuttering.
So I think we're definitely doing a lot of education each time that you come on. And another thing that I know we've hit on before, but it always comes back to what we all think about is, does insurance cover something like this?
Absolutely. Yeah. Swallowing disorders, it's a physiological problem. As I always say, you can kind of see, touch, or feel the problem, and it is mostly covered by third-party payers. Yep, Medicare, absolutely.
Putting your mind at ease that
absolutely.
You can come in and we're going to make
and this
sure
is treatable. Yeah, and if you're having trouble and difficulty swallowing foods or fluids, it's best to get that referral and come see us, because when we do bill the insurance companies will want that referral from the physician. It's easy.
Perfect. I'm going to tell them how they can get a hold of you to see if this is the right path for them. But Kyle, as always, thank you so much for coming in.
Thank you for having me.
Your vast knowledge. We always learn so much. Now, if you need speech or occupational therapy services, call Therapy Group of Tucson. They're at 232-2021. For more details, you can also visit supportvoice.com.